Okay, here we go. Part 2. Concept comfort. Non-steroidal anti-inflammatories. Non-steroidal anti-inflammatories. Remember, this is the tip that steroids are the top of the line anti-inflammatories, which is good, but not without problems. So non-steroidal anti-inflammatory, they block the formation of prostaglandins, they suppress the hypothalamus, they reduce platelet aggregation and tissue permeability, which helps to reduce swelling. They have several different properties that I'm going to make you look up. I want you to know, though, and I'm not good at pronouncing the word, but the short version is COX-1, COX-2. COX-1, COX-2. And the COX-2 specific non-steroidal is less, if not, it doesn't affect the platelets. So there's one drug out there that's a COX-2 non-steroidal, and it doesn't affect the platelets. So if there's a contraindication to take an antiplatelet aggregate, then the COX-2 may be the route to go. Non-steroidals are used for their anti-inflammatory and analgesic property, anti-inflammatory and analgesic, or analgesia through anti-inflammatory. Told you yesterday about a new drug over the counter. It's called Advil Dual Action, and it's a combination of ibuprofen, a classic non-steroidal anti-inflammatory, and acetaminophen. The complications associated with NSAIDs are bleeding tendencies and gastrointestinal irritation. Non-steroidals and aspirin, and guess what? Steroids all have the potential to cause gastrointestinal irritation. Non-steroidals, aspirin, and steroids all have the potential to cause gastrointestinal irritation. So, what do we take them with? Food. What do we take them with? Food. What do we take them with? Food. Because of their potential to decrease platelet aggregation, bleeding tendencies. So what lab work, before you start your client on an NSAID, what lab work you're going to want to look at? Other than GI and hepatic, because that affects everything. Your CBC, what's your platelet count? If your client's platelet count is already low, is it going to be a good idea to give them an NSAID? Probably not. They have a potential to affect renal, and we tell you this, and in the back of the mind you keep it there, but it's not real common unless there's already some issues. It's not real common, or if somebody decides to take, I don't know, 10 or 20 grams a day, that could be an issue. Because of the antiplatelet aggregateness, and because of the stomach or gastrointestinal irritation, no aspirin or anticoagulants. So if you're prescribed an anticoagulant, you need to avoid NSAIDs, and aspirin. And then, of course, alcohol, because alcohol can affect the liver, which plays a role in the clotting cascade. Alcohol can affect the liver, which plays a role in the clotting cascade. Ibuprofen, you probably know as Advil. Naproxen, you probably know as Naproxen. Ketorolac, you may or may not know as Toradol. Ketorolac, this one can be given intravenously. It can be given intramuscularly. It is a frequent drug. It's used frequently in post-op pain. But heads up, it can cause decreased urine output. Ketorolac, decreased urine output. Ketorolac, decreased urine output. You got a client who's post-op, they're NPO, they're getting IV fluids, we're monitoring their vital signs, we're monitoring their output. They're getting a little bit of morphine, they're getting some ketorolac, and you're like, wait a minute, when's the last time this client voided, which is a fancy word for urinated, which is a fancy word for peed. There's that COX-2 inhibitor, and you may or may not recognize that name from the bottom of the page with the drugs that looked and sounded alike. Depending on the resource, the over-the-counter ibuprofen is typically 200 milligram tablets, except for now the new combination ibuprofen acetaminophen is 250 milligrams of ibuprofen. Back when it first came out, ibuprofen was prescription only, and it was 600 or 800 milligram tablets. 600 or 800 milligram tablets. That's why most nurses, when they take ibuprofen, they take 4. Yep, I just take 4. In children, it's 40 milligrams per kilogram, or not to exceed 2,400 milligrams a day. In adults, the max dose is considered to be 3,200 milligrams per day. 3,200 milligrams or 3.2 grams. 3,200 milligrams or 3.2 grams. Food. No alcohol, no alcohol, no alcohol, no alcohol. No other potentially platelet affecting drugs. No other potentially platelet affecting drugs. If you're currently on an anticoagulant, check with your provider before taking a NSAID. Salicylate or aspirin. I love aspirin. Pain, fever, inflammation, antiplatelet aggregate. One aspirin once a day, every day, which comes under the perfusion concept. Here we're talking about pain, but just know antiplatelet aggregate. So the once a day dose is 81 milligrams to 325, 81 milligrams to 325 antiplatelet aggregate as an antithrombotic, anti-clot properties, but that'll come back to you in perfusion. Take aspirin with milk or food if not enteric coated. Enteric coated? What does that mean? Well, that means the drug has an extra outing, kind of like a hard candy shell, to keep it from being absorbed until it passes through the stomach, to prevent the gastrointestinal stomach irritation. Enteric coated, which also means you cannot crush it. You cannot crush it. You cannot crush it. Cut it in half. No. You're going to monitor for GI symptoms or signs of bleeding, black tarry stools. Black tarry stools. What besides bleeding will make your stools look black? Fresh spinach. Fresh spinach. Repeat after me. Don't give aspirin to kids. Don't give aspirin to kids because of REYES. Thought I was going to go all Aretha on you, didn't you? REYES, Reye syndrome.